Hello, my name is Shima Salim, and I'll be going over Virginia Hospital Center as my case study. All data sets were compiled by their provided reports from year 2015 to 2023 from the Centers for Medicare and Medicaid Services Hospital Data Archive, except sepsis care, which began its data collection in 2018 to 2023. Sepsis is potentially a life-threatening condition. Patients with a higher risk of infections that could lead to sepsis would consider the hospital's scoring. This could include patients with chronic diseases like diabetes or even going through chemotherapy, patients with compromised immune systems, and elderly patients who tend to have multiple health issues. How can they be reassured that this hospital is well with their sepsis care? The average time in emergency departments. Patients with conditions that often require emergency care, such as heart conditions, acute injuries, and more likely to lead to sepsis, would also consider the average wait time in emergency department. Knowing the lower the wait time, the faster they can be seen, and it could be a matter of life or death emergencies. Patients who are with chronic diseases, which have been previously mentioned, and leading to sepsis needs to know if the hospital cleanliness rating in order to reduce the risk of any complications. Typically, patients with complex or chronic conditions tend to have prescribed a complex medication regimen. Many patients, especially those who have difficulty understanding, needs to be aware of the medication instructions in order to avoid any errors. Communication about the medicine and discharge information goes hand in hand. Discharge information is highly important to recover from their conditions that caused them to be admitted. Also, a high rating of patient discharge information would prevent readmission. The limitations of the datasets are being used is that the reports prior to 2015 could not be retrieved. Sepsis care begun with 2018 report. Therefore, there will not be any reports prior to the year of 2018. The hospital archives provides the datasets within quarterly reports. There are 4 hospitals chosen for comparison. Due to all being in Northern Virginia, they are likely to serve a similar population and comparable service offerings. Therefore, being within the same region, there is a reason to suggest that Virginia Hospital Center and their competitors would deal with the same healthcare challenges, policies, and even similar patient demographics. On Medicare Hospital Compare Report, it states that the hospital center is below average compared with the estimated state average. This is why I have chosen this measured ID and compared it with your local hospital competitors. This control chart displays the sepsis care quality compliance scores for Virginia Hospital Center compared to its competitors from 2018 to 2023 reports. The blue plots represents the sepsis care quality compliance scores for the Virginia Hospital Center over the years. There is a noticeable decrease in compliance scoring from 2018 to 2020 reports, with the lowest point in 2021. However, there is improvement in 2022, followed by a decline after 2022. These scorings are below the control limits of the 4 hospitals listed in the compare list. On Medicare Hospital Compare Report, it states that the Virginia Hospital Center's average for the average time a patient spends in the emergency department before leaving from the visit has slightly surpassed the state's estimated average. Therefore, it is a reason why I chose this measured ID and to see if you are above average with the hospital competitors. This chart is reporting the emergency department ED wait times at the Virginia Hospital Center in comparison to its competitors from 2015 to 2023 report in minutes. There is noticeable change over the years. The trend seems gradually increasing with a significant dip in 2018. The 2015 report shows that the average wait time was below the competitors' upper control limit. Reports from 2016 to 2023 were above the competitors' upper control limits, meaning that these hospitals are averaging lower wait times compared to Virginia Hospital Center. This control chart measures patient satisfaction average ratings concerning medicine communication at Virginia Hospital Center. There is a clear downward trend indicating that the patient satisfaction with the communication of medicine has decreased over the years. Up to 2021, the communication on the medication were above the upper control limit of the competitors. However, it showed a gradual decrease in which does not show improvement throughout the years and is a sharper drop from 2022 to 2023, nearing the lower control limit of the competitors. This control chart measures patient satisfaction average ratings concerning discharge information at Virginia Hospital Center. Satisfaction ratings appear stable from 2015 to 2018 for the hospital, with a slight dip in 2019 below the upper control limit, but followed by a more significant drop in 2022. Then another drop, but now below the lower control limit in 2023. This control chart measures the patient's average satisfaction ratings regarding the hospital's cleanliness. From the 2015 to 2023 report, there was a drop after the 2015 report below the upper control limit, but improved and passed the competitor's control limit with the 2018 report. However, the peak was in 2020, and after 2020 report, there was a gradual decrease that went below the upper control limit in the 2023. There are many factors that could influence the change in the analysis of the results from the time of which the data was inputted. The impact of COVID-19 in 2020 has played a huge role in many hospitals and healthcare facilities. There could be a possible operational, management, or even staff changes or issues that occurred during certain reports that could have been caused a decline in the analysis or the progress within the hospital. The 5 factors of sepsis quality care, emergency department efficiency, communication about medicines, discharge information, and cleanliness are all interconnected that contribute to our hospital's overall quality of patient care for those who are managing critical conditions. Continuous improvement in these areas is essential for providing high-quality health care, maintaining high patient satisfaction, and ensuring patient safety and recovery.